In 1988, I was diagnosed with AIDS and didn't expect to be around very long. But in the year 2000, I was still around, and I'd been diagnosed with HIV wasting at that point. I went on a medicine that worked. I had to inject it every day, and I'd been on it for months, but it reversed the HIV wasting. I did notice that after a few months it would sting when I injected it, which hadn't happened before because the stinging would last till the next day, and a couple of other minor things, but it wasn't alarming to me, and I kind of made a mental note that I would go to the pharmacist and ask what was going on or if he had any ideas. In January 2001, I went and asked for my pharmacist, and he came out, and I told him what was going on, and he just said I should go home and check that I may have received some of the fake stuff. And I had no idea what that meant or how something like that could happen. And I went home and I found out. And it turns out I had received 2 different batches of counterfeit medicine, probably created by 2 different sets of bad people. I had just received them 2 months in a row, and the nightmare began. It took 3 months to find out what was in the first batch. It turned out to be a female fertility drug, human chorionic gonadotropin, and not meant to be injected every day, and not meant to be injected the way I was injecting it, which is why it would sting so much. And the second batch they discovered, it took another 3 months for me to find out about, and that was based on the contaminants they found in it, produced somewhere overseas, they suspect, and was a form of a growth hormone, but not the one I was on, and a very, very small dose. The bad guys know what they're doing and are determined to do it. There's large profits to be made and small penalties, and it's a very attractive crime. These are bad people who don't care that sick people not only aren't getting the medicine they're supposed to, they're potentially getting something really dangerous. My fear when we start talking about opening our borders, the longer that distribution chain becomes, the more opportunities there are for the bad guys to put the medicine into the distribution chain so that it ends up in people's pharmacies. Once we elongate that distribution chain outside of our borders where the FDA has no jurisdiction, where we don't know who's checking the medicine before it comes in, that's really frightening. I mean, I think that should frighten everyone. It's scary enough to me, or for me, scary enough for me to go to the pharmacy. I took over 10,000 pills last year, and having received 2 counterfeits in a row, I don't want to create any more chances for the bad guys to do what they do.